As you do your rig checks and you look through the front cabinet of the ambulance, you're going to notice we're carrying acetaminophen. It looks like this, and it's in the front cabinet because it's not a drug that needs to be brought in the jump bag or your first out bag. It is next to your other medications like nitroglycerin and other infusions that we keep in that front cabinet box. Acetaminophen is found in our protocols for pain management. It's also found in the shock protocol as an antipyretic or a drug that addresses fever, and this would be anticipated in sepsis kind of situations. It's also found in the opioid poisoning or overdose protocol. Acetaminophen is combined with a lot of opioids, and so it's in the protocol for that reason. But it is also a drug that is not that hard to overdose and do some damage with. Anything over 4 grams in a day, and you're probably harming your liver. And any medic who's transported a patient on Mucomist can probably attest to how seriously hospitals take acetaminophen overdose. If you are an AEMT or above, you are authorized to give acetaminophen, and it does not require medical control order. You just got to follow the rules, and you can give it anytime you think it's appropriate. Acetaminophen is also known by its trade name of Tylenol. It is, as I previously mentioned, combined with a lot of other drugs in order to enhance their effect. We see it in a lot of places, so it is a drug that we should be relatively familiar with. What do you need to know about acetaminophen? Well, you can start with the dosing. You'll see here the protocols call for it for pain management, for febrile seizure, and for septic shock. The adult dose is typically 15 milligrams per kilogram. It can be given PR, IV, IO, and PO, but we carry the IV version. So you can give it IV. If you, for some reason, have an IO, you can also give it IO, but you cannot give it PR or PO for either adult or pediatric in the form in which we carry it. That max dose is 1 gram or 1,000 milligrams. For pediatric, the dosing is exactly the same, 15 milligrams per kilogram, IV or IO, and the maximum dose should be 1 gram or 1,000 milligrams. If you look up acetaminophen in your source that you use for your formulary, you'll notice that they're pretty serious about medication error risk and hepatotoxicity. Acetaminophen attacks your liver when you overdose on it, and it is a very ugly, painful, and stretched out way to kill yourself if you overdose on that acetaminophen. So be careful with it and don't exceed the recommended dosing. Also, when you do your assessment, you should ask, what have they taken already? Because you don't want to go over that 4,000 milligram or 4 gram limit per day. Adverse reactions on the serious side can include your typical allergic reactions, the hypersensitivity and anaphylaxis. Hepatotoxicity is a major concern because overdosing and continuous use of acetaminophen can affect the liver. It can result in anemia and also thrombocytopenia, which is low platelet counts. More common reactions would be nausea, vomiting, headache, insomnia, especially with IV use, constipation, particularly in pediatric use, and pruritus, again in peds, and rash. If your patient is pregnant or breastfeeding, the good news is acetaminophen is safe to give to that patient in either circumstance. In order to administer it, you simply spike the bag just like you would any other medication bag. You'll note that the bag specifically says do not mix any other medications with it. This should be run separately, so don't use this bag to load in whatever other medications you're intending to give. You spike that bag and then use the infusion pump or run it to gravity or run it with a dial of flow. These are all acceptable means of administering acetaminophen to your patient. That's really the major things you need to know. I encourage you to read up on medications on your own and to practice medication math, but it would be simple. You run it at 600 milligrams per hour. That will give you a 10-minute infusion, and 10 minutes is always a safe period of time in order to give a medication. If you have any questions, contact the training center or your supervisor or your field educator. Thank you for your attention.